A statement blaming a law signed by President Bush. So what's really going on? With us now, Dr. Betsy McCoy, author of Obama Health Law, What It Says and How to Overturn It. And joining us from New Orleans, Dr. Caroline Heldman, professor of politics at Occidental College. Dr. McCoy, let's start with you. I thought we were done with this. I thought we went through this, spent a lot of time talking about death panels. They weren't included in the health care bill that became law that you have right here, portions of. But they're back. Are they back?
That's right. It appears that the administration is trying to achieve by regulation what they could not achieve by legislation. And, of course, it's a good idea to pay doctors to spend time helping patients through the tough decisions, wrenching decisions they may face toward the end of their life. But government should not be scripting what doctors tell patients.
Take our viewer through exactly what this regulation says. It allows or asks doctors, it incentivizes them to discuss end-of-life issues,
a new benefit called the once yearly well visit with your doctor or nurse practitioner or physician's assistant, not necessarily a doctor. And among the things that will be included, assessment of your weight and body weight, your mental capacities, whether you're at risk of depression, et cetera, and advanced planning or end-of-life counseling.
Professor Heldman, do we really need to incentivize doctors to ask grandma whether she wants to pull a plug year after year after year? Isn't once enough?
Well, as you bring up, Eric, it's already part of the regulation that was passed during the Bush administration to do it when folks join Medicare. So this is simply offering it more consistently. And yes, I do think end-of-life counseling is incredibly important.
Professor, why do we need to offer it more consistently? Don't you make a decision whether you're on life support, whether you want the doctor to pull a plug once or what's really troubling is that they're going to incentivize doctors, pay doctors to do this counseling.
Right, to do the counseling, not the outcome, and it's voluntary on the part of the patient. It's something that benefits families, it benefits individuals. You get to choose how you want to die. It's a wonderful benefit, and I don't know how it's possible that we're having a debate about this.
The reason we're having a debate about it is that it's not simply being offered. First of all, it's being scripted. If you look in the Obama Health Law, Section 936, the government is actually going to be creating brochures and videos.
Education? They're going to be educating individuals about options?
The government shouldn't be making brochures and videos about these decisions.
They shouldn't offer education?
To others. And voluntary, it's only voluntary if your doctor is not going to be paid less or penalized in some way if you choose not to go through that counseling or choose not to engage in advanced planning. And the fact is that Medicare has protocols and it grades doctors and pays them based on compliance with those protocols. So what we need to know right now is the Obama administration going to pay doctors less if they don't offer this counseling and if they don't get their patients to do this?
At some point, if you keep asking a patient, are you sure you don't want to pull a plug? Are you sure you don't want to pull a plug? Eventually you're going to say, all right, already enough, pull a darn plug.
That's not what this is. That's not what this is. It's simply offering it more often so that if people change their mind and want to plan for their end of life, they have that option. It's giving choice to customers.
It's going to be a drumbeat of spend less on your care, let's let you die sooner.
No, it's death with dignity. It's allowing consumers choice.
That's your opinion, but not everybody who's enrolled in Medicare should have to go through hearing about that every year.
They don't have to go through it. They don't have to. It's voluntary. That's what voluntary means.
I want to know whether doctors will have to comply with this protocol in order to receive full Medicare payment, first of all. And secondly, why is the government making these videos and brochures? This should be done by churches and private groups and not the government. The government is not the expert on when or how we die.
Professor,
no, doctors are.
Go ahead, Professor.
But
listen, I want to turn the subject a little bit, just a touch here. Representative Blumenauer from Oregon, Democrat, also, he put an email out. And this is very, very troubling. I want you to weigh in on this. The email says, and he wrote this to constituents and to friends, we would ask that you not broadcast this accomplishment, meaning that this became a regulation. And he also says, he goes on to say, the longer this goes unnoticed, The longer this goes unnoticed, the better our chances are of keeping it. Is this the way we want to govern in this country?
Well, unfortunately, Eric, that's what people like Dr. McCoy and others who've called these death panels and misled the American public have left us with. It's rhetoric. It's not reality. The fact of the matter is this is what is good for patients. It's good for taxpayers. I want to die with dignity. Others should have that choice as
not so
well.
much rhetoric.
This is the most deplorable case of Washington knows best. This isn't supposed to be the job of our federal government to dictate what decisions we make toward the end of our life.
They're not dictating anything.
Yes,
they're allowing
they are making
options to speak about it with your doctor.
Right here in the law. Oh, but then leave it to the doctor and patient to decide what's discussed. Don't provide federally sponsored brochures and videos.
Professor, whether or not
educational materials.
Professor, whether or not this was originally brought up during the Bush administration, who cares? We spent a lot of time, a lot of effort discussing the health care law. When we voted on it, we went through all the hashings. We slugged it out. You got it passed. It went through. But death panels and that end-of-life advisory board was removed from it. The discussion was off the table.
Yes.
All of a sudden, it's creeping back in.
Well, Eric, isn't it sad that it was already law, and yet rhetoric caused Democrats to be so fearful that they had to take it out of the health care bill, even though it was already available to seniors? That should tell you something about how Republicans and others have been using fear tactics to scare the American public.
Here's the insidious agenda. This law drastically expands Medicaid. 85 million people. To pay for it, it's eviscerating Medicare. It's robbing Peter to pay Paul, or in this case, robbing Grandma and Grandpa. And that's why
we're going to have to leave it there. Doctors, appreciate your time, both of you. Up next, how the Army private who